University of Ottawa in the conversation. Raywat, good evening and thank you for your time.
It's my pleasure. Thanks for having me.
Let's just start with the numbers on this Christmas Eve. Let's take a look at the provinces and how they are faring. Ontario, British Columbia, Nova Scotia, New Brunswick, PEI, Manitoba, all breaking their single-day records. How are you reading into these numbers today, Raywat?
It's kind of what we expected, and hang on to your socks because it's going to get a lot worse, most likely. And keep in mind that because people are doing rapid testing at home, a lot of people aren't seeking testing because they're afraid of the isolation rules, and people can't get tested because the PCR capacity is limited, that these are highly underestimated numbers. Numbers are much higher than what we're seeing.
You know, that brings me to ask you, let's just talk about the epidemiology of this variant. Now, we are seeing these numbers double up, literally double up, just with what has happened in Ontario, for example. How bad do you think is it going to get before we see a downward trend?
So some of the modeling I've seen, particularly out of the Institute for Health Metrics and Evaluation, IHME, suggests that Canada is looking at a peak of 200,000 cases per day in early February, and a wave ending sometime in the spring, the total infection of about 19 million Canadians by then. It could get bad. Now, that doesn't mean that all those people are going to end up with serious symptoms and hospitalizations, but when you have a seriously contagious disease like this, even a tiny fraction of people ending up in hospital is a challenge, an existential challenge to our healthcare system and to the pillars of society, frankly.
The numbers you just shared with us are shocking. Seems like a very small word to use right now.
Yeah.
But let me talk to you about the other jurisdiction. South Africa the other day said that it seems to have reached its peak, and now they're seeing a decline in cases. So what does the timeline over there tell us?
Well, it tells us that if you haven't got vaccination, if you haven't got built-in controls to control mitigation, then you could see a sharp, extremely high but briefer wave. And if you've got those other tools, like I mentioned, you can expand the wave but blunt its peak, which is weirdly what we want. We don't want an enormous number of cases all at once, because then, as I mentioned, we could deleteriously affect our healthcare system. We want to draw this out a little longer with a shorter peak. The goal, to my mind, is to protect the unvaccinated children, the under fives, who cannot be vaccinated. And we're seeing in the UK, for example, that the rates or the numbers of kids in hospitals are climbing in a troubling fashion. So our best bet is to rush vaccination and to try to stem the tide of transmission by using the tools that we know: mask wearing, ventilation, distancing, and so forth.
You know, I'm so glad you brought that point up, because that was one of my questions to ask. And if you can go a little deeper into that, how is this variant affecting children, kids who are not vaccinated? What's happening to them?
Yeah, we don't know entirely. The symptoms are similar to Delta, a bit different than anecdotally. But we're seeing in some hospitals in the USA and the UK, the number of pediatric admissions is higher. An exact number I can't give you. South Africa saw that as well. Now, are these kids experiencing really bad symptoms in the sense that they're requiring ventilation and oxygen? I don't know. Some anecdotal evidence out of South Africa suggests not. But anytime you have a hospitalized child, I worry. And
Yes.
we don't want to see any dead kids. The mortality rate, the case fatality rate for the pediatric population must be kept as low as possible. This is my biggest concern. Right, so
It is.
we
Yeah.
do hear, rumors that the disease might be milder, and it probably is intrinsically milder, but not enough to outweigh the hyper-contagiousness. So we have to do everything we can to build immunity around that pediatric population.
I have very little time, but if you could, the majority of people who are now getting infected are also the ones who have been doubly vaxxed. My question is, when do you think the third shot will make a difference, a visible change in the numbers?
I don't know what the threshold would be, but the third dose prevents initial infection and probably transmission as well. 2 doses are great for minimizing severe disease and hospitalization. That's fantastic. The third dose just prevents infection in the first place. The exact numbers I don't know, but we need as many as we can. Get that third booster if you're eligible.
Raywat Deonandan, epidemiologist at the University of Ottawa, thank you for those insights and thank you for the time on the show. We appreciate it.
Thank you.
Now,